Hello, my name is Rime. I'm an oral maxillofacial surgeon in Brazil, working in both hospital and private practice settings with a focus on dental implants. This study aims to analyze the primary intraoperative and postoperative complications and adverse events associated with zygomatic implant surgery. Initially proposed by Dr. Brannemark, zygomatic implants required a sinus lift procedures. This was later followed by the technique introduced by Stella, which involved placing the implant into the zygomatic bone supported by a groove in the maxilla. Shortly after, the technique was improved by Dr. Melhorança, a Brazilian surgeon who developed the exteriorized approach, significantly reducing complications such as orbital floor perforation and sinusitis. In 2021, Dr. Elton Faco developed the Faco technique aiming to improve prosthetic aesthetic and fit. This technique introduced the Z abutment, pillar Z, which involves the placement of a more stable implant and the subsequent adaptation of the Z abutment into it. The most common accidents and complications include sinusitis or ventral fistula, infraorbital nerve injury, fracture of components, and soft tissue injury, among others. The Zaga technique, or zygomatic anatomy guided approach, classifies zygomatic implant cases in the maxilla into different types based on each patient's individual anatomy, aiming to optimize the surgical technique and minimizing risks. The Zaga classification helps determine the ideal implant trajectory and the most appropriate surgical approach, avoid complications such as bone perforations and gingival resection. Other techniques such as guided surgeries and robotic-assisted procedures aim to reduce accidents and contamination, but do not exempt the surgeon from continuously refining their skills. However, these are valuable tools we use to achieve patient rehabilitation with greater accuracy and speed, often delivering the prosthesis on the same day, immediate loading, therapy, restoring masticatory function, quality of life, and self-esteem for our patients. Thank you very much for dedication. See you soon.